pulse may be felt at temporal artery, that is over the temporal bone, then facial artery, then carotid artery at the side of the neck. Then fourth one is the brachial artery above the elbow and in the antecubital fossa, that is inner part of the elbow. Then the radial artery in front of the wrist, and it is the most common pulse point. And the femoral artery in the groin. Then popliteal artery in the popliteal fossa, that is back of the knee. Then the dorsalis pedis artery on the foot. Then the posterior tibial artery behind the medial malleolus. And there is also another pulse which is known as apical pulse, that is palpated to count the pulse of the infant. Characteristics of the pulse. Before assessing the pulse, nurse must be familiar with the normal characteristics of the pulse, the rate, rhythm, volume and tension. So what is rate? Rate is the number of pulse beats in a minute, and normal rate in the resting adult is 60 to 100 per minute. A pulse rate over 100 per minute is referred to be tachycardia, and a pulse below the 60 is referred to be bradycardia. And there are some factors that cause variations in the pulse rate, and that is, first one is age. The very young one have a rapid pulse rate, and the adults have a normal range of 70 to 80 per minute, and the very old have relatively slow pulse rate. अभी हम जानेंगे बिफोर बर्थ से ओल्ड एज का पल्स रेट. बिफोर बर्थ जो हम FSS से काउंट करते हैं, मीन्स फीटल हार्ट साउंड से निकालते हैं, दैट इज 140 to 150 per minute. देन एट बर्थ इन केस ऑफ न्यू बॉर्न दैट इज 130 to 150 per minute. देन फर्स्ट ईयर 115 to 130 per minute. Then in the second year that will be 100 to 115 per minute. Then in the third year that will be 90 to 100 per minute. Then when the child is about 4 to 8 years, the pulse rate will be 86 to 90 per minute. And in case of 8 to 15 years, the pulse rate will be 80 to 86 per minute. And in case of adult, the pulse rate will be 70 to 80 per minute. And in case of old age, that will be 60 to 70 per minute. Next factor that causes variation in the pulse rate, and it is sex. The female has a slightly more rapid pulse than the male. Then next one factor is physique. The short person with small body build has a slightly more rapid pulse than the tall heavy individual. Then next factor is exercise. Increased muscular activity will increase the pulse rate. The next factor is food. Indigestion of food causes a slight increase in the pulse rate for several hours. The next one is posture. The pulse rate is higher when the body is in standing position than when in sitting or reclining position. Then next one is emotions. Mental or emotional disturbance will increase pulse rate temporarily. Then application of heat. Application of heat can increase the pulse rate. Then next one is emotions. Mental or emotional disturbance will increase pulse rate temporarily. Then application of heat. Application of heat can increase the pulse rate. Pain. A client in the agony of pain will have increased pulse rate. Then increased body temperature. When the body temperature is elevated, the pulse rate tends to rise. Then some of the disease condition, that is loss of blood, then injury to the viscera, shock, etc. increase the pulse rate. Heart diseases, typhoid, infection, etc. have a marked effect on the pulse rate. And in case of heart diseases, the pulse rate may be either rapid or slow according to the type of cardiac lesion. And in case of typhoid fever, the pulse rate tends to be slow. Then some type of stimulant drugs like caffeine, atropine, adrenaline, etc. will raise the pulse rate. And by administering of sedatives, drugs can reduce the pulse rate. Then next characteristics of the pulse is rhythm. Rhythm refers to the regularity of beats. Normally the heartbeats are spaced at equal intervals and they are said to be regular. When the intervals varies between the beats, it is said to be irregular. If an irregularity is present, the pulse should be counted for 1 full minute. And the abnormal rhythm in the pulse is seen in the following condition. First one is arrhythmias. It is a technical term that indicates any variations from normal rhythm. Intermittent pulse. It is one in which the beats are missed at regular intervals. In intermittent pulse, there is a difference between the apical and the radial pulse. It is known as pulse deficit. Then extrasystoles. When the cardiac contraction occur prematurely, that is before they are normally due to the cardiac cycle, it is called extrasystolic pulse. Atrial fibrillation. Rapid contraction of the atrium causing irregular contraction of the ventricles in both rhythm and force. Characteristics of the pulse is volume. Volume refers to the fullness of the artery. It is the force of the blood felt at each beat. Volume depends upon the amount of blood in the arteries. If the artery contains a normal volume of blood, the pulse is said to be full or large in volume. If the volume of the blood is decreased, as by hemorrhage, the pulse will be weak, thereby small, feeble or flickering. When the pulse is large or full and also rapid in rate, it may be described as bounding pulse. The next, tension. Tension is the degree of compressibility. It is said to be high tension when the artery is difficult to compress and low tension when it is easy to compress. Then next one is frequency of taking pulse. The pulse is taken along with the body temperature twice a day for clients who are not seriously ill. It may be taken frequently for clients who had surgeries, accidents or who are critically ill. Frequency depends upon the condition of the client and also according to the doctor's order. Then I am going to discuss about method of taking pulse. First one is palpation, that second one is auscultation. Palpation is done using the first and second or second and third fingers of one hand. Use light pressure at first in order to locate the area of strongest pulsation. After this, more forceful palpation is done to count the rate, determine the rhythm and assess the quality of pulsation. And next, auscultation. The most accurate assessment of pulse rate is the apical pulse. The apical pulse is assessed by the placing of the diaphragm of the stethoscope over the apex of the heart. The sound heard is due to the opening and closing of the cardiac valves. The apical pulse should be counted for 1 full minute. And next, I am going to discuss about respiration. So what is respiration? It is a process of taking in oxygen and giving out carbon dioxide. The exchange of gases between the blood and the air in the lungs is called external or pulmonary respiration. The exchange of gases between the blood and the tissue cells is called internal or tissue respiration. The respiration is controlled by the respiratory center in the brain called medulla oblongata. Then, characteristics of respiration. Respiration is observed to determine the rate, depth, rhythm and easiness of respiration. Rate is the number of full respiration in a minute. The normal rate of respiration for an adult will be between 16 to 20 breaths per minute. The respiratory rate varies according to number of factors. Age. According to age, at birth the respiration rate will be 30 to 40 per minute. Then in the first year, 26 to 30 per minute, and in the second year, 20 to 26 per minute, and in adolescence, 20 per minute, and in case of adults, it will be 16 to 20 per minute. Then in the old age, it will be 10 to 24 per minute. Sex. Females tend to have slightly rapid respiration than males. Then emotions. Certain stressful conditions such as fear, rage or anxiety etc. may influence the respiratory rate. Then change in the atmospheric pressure. In high altitudes, the content of oxygen in the atmosphere is very low, so that not enough oxygen is absorbed by the blood. Increased demand for oxygen by the tissues must be met by an increased respiratory rate. Then exercise. Exertion of any sort increases the metabolic rate and stimulates respiration. During exercise, the rate and depth of the respiration is increased. Rest and sleep keep the respiratory rate normal. Then, changes in the external temperature. Exposure to cold increases the oxygen need. In order to keep the body warm, it shivers. If the temperature of the body is raised by the application of heat or due to fever, the metabolic rate is increased and the respiratory rate is also increased. Respiration increases by about 4 breaths per minute for every 1 degree rise in temperature above normal. Then next one is ingestion of food and digestion. The intake of food, its digestion and assimilation increases the metabolism and the need for oxygen, hence the respiratory rate is increased. Then disease condition. Most of the diseases increase the respiratory rate. Endocrine diseases, particularly thyroid diseases, raises the metabolic rate. And as a result, the respiratory rate is also increased. Then drugs. Stimulant drugs such as caffeine, chloramine, atropine, spirits of ammonia, carbon dioxide, etc. stimulate the respiratory center and the reflex center, thus the respiration is increased. Thank you.